Heart disease is kind of a broad term for a variety of different possible cardiac issues. Sort of classically, when we talk about managing your cardiac risk, we're talking more so about atherosclerotic coronary disease, blockage type issues. But heart disease would also refer to electrical issues with the heart or rhythm disturbances, structural issues with the heart, so problems with the pump in terms of cardiomyopathy, or valve issues as well.
But how do you know if you have heart disease? What are some of the symptoms?
A variety of different things, manifestations with exertion or activity. So obviously if you're getting a chest pain or discomfort or shortness of breath or just decreased exertional tolerance, not able to do what you were once able to do. Other symptoms like palpitations or fluttering in the chest or lightheadedness, all of those would be potential signs or symptoms of underlying heart disease.
How exactly is heart disease treated?
It really depends on what the other underlying issue is. For coronary disease and a lot of heart disease in general, we usually start with medical therapy. And ideally, we try to be on the primary prevention side, so try to be more preventative to prevent issues down the road. But in patients who have established, heart disease, if it is a blockage issue, then we have transcatheter or percutaneous routes to fix that with balloons and stents. Sometimes more advanced disease or complex anatomy requires surgical intervention. On the structural side, there's more and more capabilities to fix things with transcatheter therapies now as opposed to surgery, but really depends on what the underlying issue is.
Speaking of prevention, what are the best ways to manage or help lower your heart disease risk?
I think the most important thing would be, just trying to make healthy lifestyle changes and decisions. So trying to eat a healthy diet, and we recommend more of a Mediterranean-style diet or anti-inflammatory diet, which has been shown to improve mortality and decrease your risk of cardiovascular events like heart attack and stroke. Regular exercise, trying to be active 30 minutes a day most days of the week. And then following with your primary care physician or provider to modify risk factors for coronary disease. So if you have diabetes, making sure that's well controlled, making sure the blood pressure is well controlled, treating the cholesterol if it's high, and trying to manage your stress levels as well.